Mary's polio was so severe it's left her a quadriplegic. But she's the first to tell you she's had a fantastic life, a great job, she's studied, travelled and lives in her own home.
I think my greatest achievement is living independently in my own home. Something I never thought I'd do, having lived in a family home all my life. 8 years in Fairfield, Ward 12, and always having to have somebody do everything for me. And I still have to have somebody do everything for me. But I have attendant carers who come in at prescribed times to assist me, and I have a wonderful life.
Mary has recently started using nocturnal ventilation to reduce the effects post-polio was having on her breathing.
Since I've been ventilating, I've certainly been able to do so much more. I've always had some sort of ventilatory assistance, but not to the extent that I have now. And I knew then that it's not really a backward step, it's something that's enabled me to go on and to be very positive.
Mary, I've just come over today to do a check-up visit since you started on your ventilator.
Mary is meeting with Anne Duncan, a specialist from the Victorian Respiratory Support Service from the Austin Hospital. She is the outreach coordinator and visits people in their homes to check on their health and help them and their carers learn to use the numerous breathing aids that are available.
Most people have it in a similar ballpark, but if it's 10 centimetres lower and Mary feels fine, there's nothing to worry about. From a respiratory nursing point of view, we're looking at people who are already using a ventilator to support their nighttime breathing, to maintain normal blood gases, and our role there is mask fittings, troubleshootings, re-prescribing ventilator settings, and doing reassessments of just patients' general well-being. Well, when we sleep, or any time, the respiratory centre in our brain tells us when our carbon dioxide level is rising, and we take a breath in response to that. When you have muscle weakness, such as with post-polio syndrome, and you go to sleep, then your muscles may not be strong enough to give you enough air to keep your blood gases at normal levels. Each person has their own sort of normal range, but the main one we would look at is the carbon dioxide level, and that should be, the range is 35 to 45, and when it's getting close to 45, your brain will tell you to take a breath. But in people with muscle weakness, the breath they take may not be adequate to keep that carbon dioxide at normal levels. So the ventilation is to keep the carbon dioxide at normal levels. That means that there's energy that she used to use while she was asleep for breathing is now conserved and available for her to use during the daytime. So she would have more energy for daytime, she would be less likely to feel sleepy in the daytime, she would be less likely to have morning headaches, and she would be less likely to get colds and flus.
It's enabled me to carry on with my independent lifestyle that I've got now, thanks to attendant care. It's enabled me to continue working. I've worked on a full-time basis for a long time now, and it just gives me that little bit of energy and zest that I need to go through the day.
I have seen people who were unable to leave the intensive care unit go back to full-time work as lawyers, back to their family life as mothers and fathers, back to manual work, light manual work.
If the respiratory side of things is all right for you, you feel, but your muscles are getting tired, okay, it might well be that for you it's just getting older, but firstly check up and put that. It might be that you need some small piece of equipment to assist you to manage, to improve your ability to just to give you a little bit of relief, so that that weakness that's coming on that you think is only old age can be helped.